Hello and good afternoon. Thank you for joining the webinar today. We will give folks about 1 more minute to get dialed in and set up their computers, and then we'll go ahead and get started. All right, we can go ahead and get started. Hello and good afternoon, everyone. My name is Cheng, and I am the Strategic Partnerships Manager here at CareMessage. Thank you, everyone, for joining us for today's webinar, showcasing an amazing array of speakers and folks from the Florida Safety Net. We are so excited to be partnered with the Quantum Foundation for this webinar on CMLight and to highlight some of the important use cases and solutions that organizations like Community Health Centers of Pinellas have worked on and will be sharing with you to address COVID-19 and using text messaging to reach their patients during this time. Without further ado, I would love to welcome the Quantum Foundation, Randy Scheid, to kick us off on today's webinar.
Thank you very much, Christine. Hello, everybody out there. Thank you so much for joining us today. And Christine and Jessica and Howard, thank you for the help pulling this conversation together. We're super excited to be here as a part of this discussion. As Christine said, my name is Randy Scheid, and I'm the Chief Strategy Officer at Quantum Foundation here in West Palm Beach, Florida. Our mission is to inspire and fund initiatives that improve the health of our communities. As some of you know, our interest in promoting the use of technology extends back to 2015 when we hosted the first hackathon here locally to develop new digital solutions to health access. So when Christine reached out to discuss whether we could assist in spreading the word here in Florida about CareMessage, it was a no-brainer for us. Everyone knows that the use of technology to promote good health has now only increased in this pandemic. And in a moment, you'll hear more from Christine and Howard about their experience to date with this tool. And hopefully, Christine can tell you about some of the heavy hitters behind this effort. And finally, at the end, you'll have an effort and an opportunity to hear how you can remain involved with CareMessage. So with that, I'll turn it back over to you all.
Thank you so much, Randy. Just a brief note on housekeeping and logistics. If you have any questions throughout today's webinar, please feel free to use the chat box or the Q&A function in Zoom to submit your question. Please feel free to share your name, your organization, and if there's a speaker who you'd like to address the question specifically, please feel free to share that as well. Today's webinar is being recorded and the presentation will be shared with all attendees and registrants afterwards. A very brief introduction to CareMessage. We are a 501c3 nonprofit organization founded in 2012. We are unique in our focus and commitment to working with underserved communities and safety net providers in how we build our patient communication solution. We are the first and only patient engagement platform designed specifically for safety net organizations. And through our focus and mission as a nonprofit, worked with over 300 safety net organizations to date and have reached over 6 million patients through our messaging platform. Since March of 2020 specifically, throughout the pandemic, we have helped our organization send over 20 million messages related to COVID-19. We are especially proud and grateful to our partners in the Florida Safety Net, not only CHC Pinellas, but the other health centers you see listed on this slide, as well as our partners like the Quantum Foundation and Health Choice Network. A brief note on what's brought us here together, of course, is the desire to have impact and to be able to reach and support not only underserved communities, but of course, the providers and organizations that support underserved communities during this time. One of the efforts that we launched in March of 2020 is an effort called Project Equity, which is what's brought us here together as a concerted focus on being able to disseminate our free CMLite solution to safety net providers working with communities who are disproportionately affected by COVID-19. A brief note on CareMessage's full platform. We are a comprehensive patient engagement platform, and our different FQHC and free and charitable clinic partners leverage our different features and functionalities to reach patients with the most relevant and appropriate messages based off of that patient's unique needs, whether it's bidirectional appointment reminders integrated with the EHR, or group outreach to reach patients for quality messaging or non-clinical use cases, or the ability to deliver health education and coaching in an automated fashion. CareMessage's full platform focuses not only on being a technology provider and solution for FQHCs, but of course, being a partner in content. All of the content that we create, and you'll see this in our COVID-19 library, is written at a 6th grade reading level or below. 30% of our content is written at a 4th grade reading level or below, and offered in culturally relevant English and Spanish translations. We'll only touch briefly upon integrations. Of course, we integrate with the majority of EMRs that many safety net providers use today, as well as the population health management solutions, Azara and I2I, and Relevant. We'll talk quite a bit about content in today's discussion, specifically related to COVID-19 use cases, but wanted to make mention of the focus that we offer and have always had as an organization, again, not only in being a technology and software focused company, but also being able to be a partner to FQHCs and thinking about how to drive meaningful engagement with patients through thoughtful and curated content. cmlight, as you can see here, is a specific and focused solution to help safety net organizations reach patients and offers 2 functionalities for communication. The first is group outreach, so the ability to send a single message out to hundreds or thousands of patients. This can be to remind patients of social distancing guidelines and recommendations, or hand hygiene support, or letting patients know that your organization has now resumed in-person services, or perhaps sending any kind of content related to non-clinical use cases, as well as the ability to do one-to-one direct messenger. So this is any type of one-to-one patient communication between anyone within the health center and that patient. During COVID-19, we've seen direct messenger used often by organizations for care coordination and care management. cmlight is intentionally designed as an unintegrated solution because we want our partners to be able to get up and running on this platform within a matter of days or even hours of having access to the platform. And in the demonstration today, I'll show you what it actually looks like to upload a patient list into CareMessage or cmlight specifically to be able to reach your patients quickly and at scale. And of course, I do want to make mention that cmlight is a free solution for any safety net provider during this time for a minimum of 60 days. We are so proud to partner with organizations like Johnson & Johnson who have made this possible through their generous philanthropic support, and want to reiterate that for any safety net organization using cmlight, there's no long-term commitment, there's no obligation to purchase our full platform. In addition to our free platform, we have created a public and free COVID-19 message library. Organizations do not need to use CareMessage or even cmlight to have access to this library, and we'll be sharing the link in email follow-up with you all today. And in this library, you'll see numerous use cases and templates for messages that your organization may send. On the right-hand side here, you see a few examples of the types of messages that our partners have sent in the past months. And some of the trends and topics that you've seen, that you see here, reflect the shift in communication that we've recognized as an organization throughout the coming months. So a great example of that is in the bottom left-hand corner. Of course, many organizations right now are thinking about not only the clinical needs that their patients have, but what are the socioeconomic needs that patients face regularly, but are now even more exacerbated given these trying times. And so here's a great example of a health center that partnered with a local food bank to offer drive-through fruit and veggie pickup. They use CareMessage or CM Lite specifically to send this information out to their patients, provide a condensed URL link to additional resources and information about this event, and then even use CM Lite to collect RSVPs from patients so that they could better understand the volume of resources that they would need, as well as the ability to promote social distancing and ensure that this event was a safe experience for everyone. We will cover this example in the demonstration, so I won't linger too much, but of course, all of the messaging in CM Lite is bidirectional, and we know that this is incredibly important for safety net providers. Again, not only right now, but in the normal course of communication with your patient population. And this is a great example and one that we saw health centers sending out, particularly in the spring and early summer as their organizations were implementing telehealth solutions. And in this case, this health center actually just wanted to identify the different communication preferences and visit preferences that their patients had, whether it was a telephonic visit or using a platform like Zoom or Doxy.me to have a telehealth or video appointment. Or perhaps not at all. And you can see that through CareMessage, organizations have the ability to customize that response and automate that response so you're not actually replying to each individual patient. And again, we'll go through this in the actual demonstration. I will go ahead and log into CM Lite. Oops. And immediately upon logging in, you'll see that I'm brought to the CM Lite dashboard. CM Lite offers me a high-level understanding of all the patients that we're reaching in this demo environment. On the left-hand side, most importantly, you see the navigation through the different functionality to be able to start reaching your patients. I mentioned that CareMessage or CM Lite is intentionally designed as an unintegrated solution. And so for users of CM Lite, they'll begin by uploading a patient list or file into the platform. Upon uploading patients into CM Lite, they'll be able to create a group out of the patients in that list. So this is where we start to support cohort management, the ability to reach patients based off of preference and ensure that we're sending the most relevant messages to them. And of course, you'll always be able to see all of the patients in your platform by clicking on patients here. Once you've uploaded your patient list or your population into CM Lite, you can begin sending messages. I've navigated over to the CM Lite outreach dashboard where you can see all the ongoing messages or different campaigns that your organization has scheduled to go out that you've already sent out, as well as ones that are active and open. And so in this example, you'll see a flu shot reminder. We know that many organizations are thinking about, again, not only is the flu shot important every single year, but how in this environment can we really encourage the flu shot, provide that additional education and context as to why it's so important this fall season. And then perhaps if your organization has made adjustments to how patients can actually come in and receive a flu shot, you'll want to communicate that via text message. In this example, you'll see that we can see the total number of patients we've reached, some high-level metrics and understanding of who's responded to this message. And then most importantly, the ability to click in and see who are these 30+ patients we've received. Can we look into the individual conversations that are taking place? And in this sample size of 30 patients, it's very easy to eyeball the list and get a sense of who's responded or who hasn't. But of course, as you can imagine, when you're reaching hundreds or thousands of patients, you'll want the ability to filter by a patient response type. Or in the instance that a patient were to reply with an unrecognized response, as we call it, CareMessage will automatically flag responses that need additional review. I'll go ahead and walk us through an example of how to set up an outreach. We'll start by selecting patients who we want to reach. In this instance, I have the ability to perhaps grab or select a group of patients that I've uploaded into the platform, or I have the ability to quickly compile a group based off of other demographic information I might have uploaded in that file. I'll always have the ability to review all of the patients that we might be reaching. Perhaps I'm only selecting these 4. And from there, I can select a template. And in this example, I'll grab the telehealth example that we discussed in the presentation. And you can see here, we have the ability to structure the responses for yes, no, multiple choice, open-ended, or perhaps no response needed. And of course, in addition to having access to the templates and the content that CareMessage has put together, your organization always has the ability to customize these messages or craft these originally on your own. I'll select a date and time to send this message, and I'll go ahead and create my campaign. Finally, I will walk us through very briefly what Direct Messenger looks like with CM Lite, which is our ability to facilitate one-to-one patient communication. As you can see here, the dashboard gives me insight into all of the patients we might have ongoing discussions with. And in this example with this fake patient, you can see that we've communicated with this patient to share a variety of information, and there's no limit to the type of message or topic that you can, of course, communicate to patients about, whether it's sending a specific telehealth link for their visit, or perhaps following up on a social referral or resource you might have offered to that patient. And one unique use case that we've seen, and that I know that Howard will talk about today, is just how to use text messaging to support patients for a virtual waiting room to, again, ensure that as your organization may be resuming or has already resumed normal services and operations, how do we still promote social distancing in a healthy environment for everyone? With that, I will turn things over to Howard Rubin.
Thank you, Christine. I appreciate the opportunity to talk about how we are using CareMessage to keep engaged with our patients. So a little bit about Community Health Centers of Pinellas. We are an F2HC. We're located in Pinellas County, Florida, with our headquarters in Clearwater. We have about 12 locations across the county, as well as a mobile health center that we use for a variety of functions across the county, everything from doing medical exams at homeless shelters to providing dental services for shelters and things like that. We have a patient population of approximately 55,000 unique patients, and last year we did over 185,000 visits in 1 year. Most people don't realize how large Pinellas County is, and we serve a county of almost 1 million residents, and that can be plus or minus a couple 100,000 depending on the time of year and how many tourists we have down at the beaches in Pinellas County. Our EMR currently is Greenway Intergy. We're on version 12.00.06, and we offer a variety of services to our patients, everything from medical services such as family practice, pediatrics, women's health, dental services. We have in-house pharmacies. We have a very strong behavioral health program. We have chiropractic services as well as family planning services. Next slide, please. I want to talk a little bit now about some of the use cases we've had during COVID-19. The first category of them is communicating urgent messages to our patients. So as I'm sure you can all be aware, that we've had a lot of changes during COVID, and we've had to close some of our clinics and reopen them at various times based on our staffing ability. So getting the message out to our patients about how we are closing a particular clinic and making services available at another clinic was really critical to make sure that our patients could get the services they need. Like everyone else, we were doing telehealth as well, but a lot of our patients still were choosing to come into the clinic. They either needed lab services or other things that they couldn't get via telehealth. So we wanted to make sure that we were providing them with the information necessary so they could get to us. As we went through COVID, we also were reopening some of our clinics that may have been closed as we were able to bring additional staff back in. And we wanted to make sure we were communicating that out to our patients to say, hey, you know, your local neighborhood clinic is now open and taking appointments. Please call us to come in. We also wanted to make sure that our patients understood that we took safety very, very seriously, and that we had a variety of measures that we were taking to make sure that if they did choose to come into the center, that they came into a healthy and safe environment. Everything from limiting our patients in waiting rooms, and I'm going to be talking about that more later, the requirement to wear a mask. We have temperature takers at every entrance to every one of our facilities taking temperatures of everyone coming in, wiping down everything, special filters in our HVAC system. So a variety of things, because we got the word from our patients that they were nervous. And they wanted to make sure that if they were going to come in for a visit, that they were coming into a safe environment. We also started doing some fairly extensive COVID-19 testing. At this point, we've done almost 25,000 tests of citizens throughout the county. We had COVID testing sites at a variety of locations. When we opened our testing initially, we were taking almost 1,000 calls an hour from residents who wanted to be tested. As you can imagine, it pretty much overwhelmed our call center, and we luckily had some great partners that were able to help us out on taking some of those calls. And as we added additional services, we wanted to communicate that out to our patients. We added walk-up and drive-up services. You didn't need a scheduled appointment any longer. We were changing hours and locations. Some of our sites, they became so overwhelmed with cars coming in that they were backing up streets and highways. And so we had to move things around for safety to make sure that we could get our patients through the COVID testing without causing an accident on the roads around our centers. At one point, we also had to cut back on our testing due to shortage of test kits. So we wanted to make sure that we didn't have patients driving in and finding out, oh, I drove all the way here and you're not doing testing right now because you're short on kits. So we did a lot of communication out to our patients to make sure that they had the latest information because everybody was so concerned about getting testing done. We also moved from the PCR testing, which is your typical testing that are done by the major labs like Quest and LabCorp, to rapid testing where we could get a result in 15 minutes. And we were doing that for emergency responders, public safety, and government. And we are now doing that. We're the primary testing site for the Pinellas County school system for teachers and students as well. So we wanted to make sure we got that information out to all of the citizens of the county so that they knew when they could come in, where they could come in, and how we were doing testing. We're also trying to make sure we're reaching out to cohorts of patients so that we're getting very relevant and customized messages. We don't want to bother people with messages that don't have any impact for them. So, for example, when we started resuming preventative care, we were sending out specific messages to certain patient cohorts to let them know that you didn't actually need to come into a center, that we were actually doing drive-through A1C testing and blood pressure testing and other vitals. And so you could still safely come in and have that done without having to go into the center. We also wanted to make sure our patients knew that even during COVID, there are certain tests that are necessary to make sure that you're healthy, and that we wanted to make sure that they knew that they could still get mammograms and Pap tests and FIT or colorectal tests, even during COVID. And so we were communicating out to our patients that might be due for those to let them know that they could still come in and get those done. We also had set aside certain sites as well-child sites. So those particular clinics were set up and we were not scheduling any sick patients in those, no COVID patients in those. And so that parents could feel comfortable bringing their children in those particular centers to do well-child visits, to get immunizations. it's critical that we ensure that our pediatric patients get their immunizations on the right schedule at the right time frames. And we didn't want everyone losing 4, 5, 6 months of immunizations because they were concerned about coming in. So we wanted to communicate out that they could come in safely and get those immunizations and remind them that their child was due for those immunizations. One other area we used it for was actually for our employees. So we loaded all our employees into CareMessage, and we used it for employee communication. We're testing all of our staff bi-weekly for COVID-19. Every other Monday morning, all staff have to be tested before they actually can go into the center. So we send out reminders on Friday afternoons and then Sunday afternoons to remind staff that they need to come to the center early and get tested before they can go in and start taking care of patients. Also, we require all of our staff to have flu shots, and so a reminder that they need to come in and get their flu shots on certain times. And being in Florida, of course, we can't get away from hurricanes and other natural disasters, and it's important for us to be able to communicate with our patients, our patients and our staff, what we're doing. So when we recently had a hurricane that was coming near our area, luckily it did not hit us, but coming near, we wanted to notify all our employees that, hey, we need to start implementing some of our emergency preparations and let them know that we would be communicating with them if there were any changes to schedules or if we had any clinics that were either open or not open, maybe because of flooding, and that they should go to a different facility. We wanted to make sure we were staying in close communication with our employees. And so we've used CareMessage for all of those things, as well as many others during these times. We also have a number of future initiatives. Those future initiatives are actually fairly soon, but they are not implemented currently. We're doing some preventative appointment campaigns where we're going to be reaching out again to some of those patients that are due mammograms and PAPs, and ask them basically, can we call you, or do you want to call us? We'd love to have you come in. We can do it safely. It's really important to get some of these tests and then use their answers to call back out to them to make sure we can get them scheduled. Back to school. Here in Pinellas County, we have a hybrid model. So parents were able to choose whether students wanted to come in live to the schools or work virtually. We want to make sure that those children that are virtual still have their physicals. Just because they're going to school virtually doesn't mean they don't have to have all of the things that are necessary to keep them healthy. And so we're looking at doing some back to school campaigns for the children that are in school, but also significantly encouraging the patients that are doing virtual schooling, that it's still important for them to come in and have a physical and have their immunizations and get a checkup. Flu season is coming up as well. And like everyone else, we want to make sure that we notify all our patients that it is flu season and we want them to come in and have their shot. We are looking at a multi-stage flu campaign. Initially, we're looking to do a broad message of just, it's flu season. It's really important, especially during COVID times, for you to come in and get your flu shot. Then a little ways into the season, we're looking at using some of the outreach campaigns that have already been built in the library that CareMessage has, to be able to go out and say, have you gotten your flu shot yet? Yes or no. If it's yes, we want to make sure that we put that into the patient's record so that we're not bothering them and calling them and asking, have you gotten your shot? Well, we already know the answer to that, and we can put that into their record. And if it's no, we want to have a group of our staff calling out to those patients that say no and saying, hey, can we schedule you to come in and get your flu shot? We have plenty of openings. It's really important at this time of year. We are also starting to have some discussions about vaccine preparation for COVID-19. We've been notified, like everyone else, that the vaccines are hopefully going to be coming sometime later this year, early next year. And so we're having some discussions about how do we communicate out what our plans are for providing those COVID-19 vaccines. We know our patients are extremely nervous about them, are extremely interested about it, and we want to make sure that as we get the information from the government, that we get that information out to our patients so we can keep them aware of what the plans are, how they can get those vaccines if they choose to, where they can go, and if they have any questions about the vaccines, that they can contact us and we can give them more information. Next slide. So as I had mentioned, one of the things that we were trying to do was make sure that our patients understood that we took safety very seriously when it comes to COVID-19. And we wanted to make sure that they felt safe and that it was a safe and healthy environment in our centers. And in one of those ways is to limit the number of patients in our waiting rooms. And that was extremely important to us. We started out in the beginning weeks and months of COVID that we wanted to have no more than 6 people in our waiting room at any given time, which for some of our smaller centers was not that difficult, but for some of our larger centers, we typically would have anywhere from 10, 20, even 30 patients in our waiting room at any given time. And so we looked at how do we help make sure that we have a limited number of patients. At first, we were just having patients when they came in. If we had more than 6 patients in the waiting room, we would ask them to go back out to their car and sit in the car, and we would have somebody run out and let them know when either there was an opening in the waiting room or when it was time for their appointment, that they could go straight back to the exam room. As you can imagine, that isn't very effective or efficient, having our staff running back and forth to the parking lot. So after that, we started taking cell phone numbers down from our patients. And so we'd ask them when they came to the front desk, could we get their cell phone number? And if they could go back out to the car, we would text them when it was time to come in. And our front desk staff would be keeping sticky notes all over the place, or pad and list of phone numbers with patients. And sometimes they forget to text them, and sometimes they lose the sticky note. And although that was better than running out, it still wasn't very effective for making sure that we got our patients in time. And so we moved to a product called Tables Ready. It's actually primarily designed for restaurants. So when you go to a restaurant and there's no table ready, they usually either give you a little square that lights up when your table is ready, or they take your phone number down and text you. And so they have a healthcare version of that that we were able to use. And together with CareMessage, we were able to set up a system where the day before your appointment, we would pull a list of all of our patients' appointments, and via CareMessage, we would send out a message to all those patients with a link to the Tables Ready dashboard, and ask them that when they arrive at the building, stay in their car and log into that Tables Ready dashboard and let us know you're here. And so the patient would then log in, and when they log in, the system would automatically send them back a text that says, thank you, we know you're here, and we will let you know as soon as it's time to come in. That kept our patients from having to come into the center and still be able to be in communication with them. We also are able to send them text messages during the time they're out. So if for some reason we're running behind, or there's a delay of some kind, we can text the patient while they're out in the car and let them know, and we apologize, we're running about 15 minutes late, please wait and we'll let you know. Once they're ready, our front desk staff can easily just click a button and notify them that it's time for their appointment, and they can come in and have their appointment. We tested that out in a smaller site just to make sure we didn't create too big a problem. And then we rolled it out to all of our sites. And it's been extremely effective in allowing us to keep a limited number of patients in our waiting rooms and make sure that we are keeping them safe for our patients. I think that's all I have right now, Christine. Thank you.
Thank you so much for walking us through the various different use cases, how you thought about using patient communication during this time, as well as communication out to your team and staff. As we open up into Q&A, I do want to share some of the resources that we've described today. First and foremost, of course, if your organization is interested in learning more about CMLight, please feel free to head over to our website, and you can submit a form to hear from our team today or tomorrow, and we're happy to get you started on the platform. as well as links to the free content and message library that we've created. Folks, for those of you who have questions, please feel free to use the chat and the Q&A for any questions that you have. And as people are typing this in, it looks like we've already received a few, so we'll start to address those in the order they came in. The first question that we received was, is this, I assume CareMessage or CMLight, is CMLight intended to replace messaging through a patient portal? And I'm happy to take this question. In many instances, organizations will make that decision based off of patient portal utilization. And because of that, often do replace some patient portal communication with CareMessage. An important factor in this is the barrier to entry that exists with patient portals, whether it's access to a computer or laptop, access to Wi-Fi, even the barrier to access the patient portal with an email and having a password. Many organizations have turned to text messaging to communicate with patients because with CareMessage and CMLight, we deliver all of our messages via SMS. That said, we do understand that there are specific and PHI-related communication and topics that need to take place in the patient portal. And so in some instances, we've even seen organizations using CareMessage to send and redirect patients to the patient portal by sending them a text message, for example, your lab results are ready, and offering that condensed link so that they can click to log in. And if they're on a smartphone, be redirected to their web browser. We received another question. How are you getting and documenting patient and employee authorization to text? I'm happy to address this from the CareMessage side, and then Howard, hopefully you can also weigh in on how CHC Pinellas thought about this. With CareMessage, we do recommend an opt-out approach. We do offer patients in the content of our text messaging to opt out at any time. So by texting stop to opt out of receiving any messages. And we even offer health centers the ability when they're getting onboarded onto CareMessage to send what we call a welcome message, which effectively introduces patients and says, welcome to CareMessage, we are CHC Pinellas, we'll be using text messaging, reply stop to no longer receive these messages. Howard, would love to hear from you on how your organization has thought about this.
Sure. So when our patients register with us, they're given a form, or actually now we do it digitally, an opportunity to identify what the various means of communication are. So they can put in their mobile number, their home number, their email, and they also then choose how they would like us to communicate with them, whether it is via text, whether it is via email. And they also can say, we do not want to be contacted. And so we store all that in our EMR. And when we do our feeds to CareMessage, CareMessage is actually able to read whether the patient has asked to be communicated via text, via voice, or do not contact. And if it is set up as do not contact, then CareMessage does not send that message out to the patient. So we use that filtering for all our patient communication. For our employees, our employees, when they first come on board, authorize us to communicate with them via text right from the beginning.
Great, thank you, Howard. We received another question. What is CareMessage planning to do to develop messaging around the COVID-19 vaccine? I'll also take this one. This is an incredibly important topic and focus for our organization in the coming months, and even as we think about 2021 planning. To support the efforts of safety net providers, we are engaging right now in doing the research alongside, I can imagine, with many of you to understand what is most important to communicate with patients, starting with dispelling myths and providing reassurances to patients around the vaccine, and being able to support the work that safety net providers are doing right now to be an established source of information to, of course, build up trust and confidence in what the vaccine can do, to go to their community health centers and to talk to their providers about this. So education is an important component, being able to redirect and direct patients to the right resources. And then we are working on developing content to support many of the health center operational considerations for potentially delivering the vaccination. So organizations and health centers, even as they're thinking about perhaps their flu shot operations, how to communicate that your health center or specific sites will offer the vaccination, what sites to go to, what that process will look like, as well as perhaps if patients do need to receive 1 or 2 doses, what that might look like. So at every step of the development of the COVID-19 vaccination, how health centers are thinking about and will approach the actual process of delivering the vaccine, and any communication thereafter, CareMessage will be developing content to support that effort, and we'll be working with our users and other experts in this field to develop that content as thoughtfully as we have with any of our other clinical content. We have another question. After the 60-day trial, what is the cost? CareMessage's full platform is an annual subscription-based model. It is intended to be and is intentionally designed as a subscription-based software cost, because we want to allow health centers to have as many messages or send as many messages as possible, have as many providers and staff members accessing the platform. So it is a tiered annual subscription based off of your total patient population that your health center serves. And it looked like there might have been 1 or 2 follow-up questions around pricing and a good clarification from one of our participants. After the 60 days, and you choose to continue, how does the pricing plan work, per text or per patient upload, which is a really great way to distinguish CareMessage between other platforms that may actually charge per text. Ultimately, with the type of engagement that we promote and really believe is most meaningful to reach patients and improve health outcomes, we of course do not want to charge per text, because it ultimately inhibits the ability of the health center to reach patients and to have as many communication lines as needed to serve that patient. We'll go ahead and give folks just another minute or 2 to submit any last questions that you may have. As a reminder, of course, we will be sending out the recording of this webinar, the slides to you all tomorrow morning, and it will include all of the resources and the links that you see here. If there aren't any further questions from our audience today, we'll go ahead and wrap up today's webinar. Thank you again to the Quantum Foundation, Randy, for co-hosting this incredible opportunity with us. And thank you, Howard, for your participation, for sharing your work with all of us today. And thank you again. Please feel free to reach out with questions. Have a great afternoon, everyone.
Thank you.